What I like to do, and what I really enjoy doing, is being able to offer patients an infusion that is, again, specific for their condition, and they walk out of the practice feeling better than when they walked in. One of the most important ones, and one of my most favorite over the years, has been chelation. The technical process of chelation is simply the administration of an amino acid, a synthetic amino acid called EDTA. That is the primary one that's been around for 50 years. It's very safe, very effective at removing heavy metals, lead, mercury, cadmium, tin, aluminum, arsenic, even uranium and some of the other earth metals. As we accumulate these over time, they actually accelerate the rusting process. And that rusting process contributes to the aging process, poisons every gland, tissue, organ, and cell in the body. People with elevated levels of heavy metals, because they have mercury amalgam fillings, and they've had them for 30 or 40 years, that have been leaching mercury into their systems, guaranteed when we test them, they show higher levels of mercury than average. We have folks that eat a lot of fish. Everyone loves fish. We've had, they've been telling us to eat more fish over the last 20 years. Well, guess what? Fish are one of the most contaminated species in terms of mercury. And so these folks that we test who eat a lot of fish, they end up with extremely elevated levels of mercury. And there's only one reliable way to get rid of that mercury, which is the most toxic heavy metal on the planet, short of uranium, and that's chelation. So we offer, the intravenous form is by far the most effective. It's the deep cleaning. It's virtually painless. It's quick, 10 minutes. You're given other minerals, vitamins, and antioxidants with the formula. It's very effective over time at removing these heavy metals and improving many of the different parameters that I just discussed. One of the most important, again, being a person with heart disease who comes in who may be facing bypass. Doesn't matter if they have 3 major blocked vessels or 1. We can improve the circulation to their heart muscle. We can detoxify the heart muscle itself of heavy metals, which has been found to be very common as well, mercury and lead and cadmium, and actually improve the functioning of the heart in many cases as well.